Hi everyone, this video is a primer on the head and neck vasculature. You can imagine yourself as a drop of blood flowing through these vessels. Obviously I'm not going to be able to cover every permutation or encountering a blood vessel may have as it travels through this vasculature, but hopefully you'll get an idea of the principle that clinicians need to understand the typical structure of blood vessels through the arteries and through the veins. So imagining your drop of blood can be actually a fun and useful exercise. So what we're going to do here is trace a drop of blood. We'll use we'll use a color of red to be able to do this on these images. So let's say we're starting from the left common carotid artery, and here's our drop of blood there, and it's going to roll up this way superiorly, and it'll encounter the common carotid artery bifurcation. And if we're looking on the image on the right, this would be a similar path. You might remember that the common carotid artery bifurcation has a bulge called the carotid sinus. This is where baroreceptors are going to detect pressure in the blood and will communicate that sensory information, that visceral sensory information, via cranial nerve 9. And adjustments will be made in the brainstem through a variety of nerves. One of the principles would be the vagus nerve as it comes down and innervates the heart. The other thing that is located here are chemoreceptors that are detecting blood chemistry, which also is the information of which is also traveling through cranial nerve 9. So back on the image on the left, if this drop of blood is coursing here and decides to go superior through the external carotid artery, one of the arteries it's going to pass is the superior thyroid artery, which is generally one of the first branches off of the external carotid. And the superior thyroid artery, if this drop of blood were to go this way, which we're not going to go, but if we were to continue this way through the superior thyroid artery, it could also go into the superior laryngeal artery, which provides vascularization for the larynx. Likewise, that drop of blood could go all the way to the thyroid, and so forth and so on. If we continue up the external carotid artery, we'll go to the image on the right. So we pass the superior thyroid artery. Typically we pass, or I should say the drop of blood passes the lingual artery. Notice that the lingual artery is coursing towards the tongue, which isn't pictured here. But then the drop of blood could pass the facial artery. Now the facial artery and the lingual artery can sometimes be switched. As with the thorax, abdomen, and pelvis, arteries are always named for where they go, not from whence they came. So a drop of blood could go into the facial artery and to the anterior face, as so, and eventually could end up in the lower face, in the mental artery, the inferior labial artery, the midface, the superior labial artery. It can even enter into the orbit via the dorsal nasal arteries. All right, but we're going to continue on through the external carotid, and here we're going to enter into the maxillary. Now that drop of blood could have easily gone into the superficial temporal artery, which is going to supply the lateral head, lateral aspect of the head here in this region. Or that drop of blood could have traveled into the posterior auricular artery, or even earlier, the occipital artery. And I do want to mention the occipital artery for a second. The occipital artery is actually a good posterior landmark for finding the hypoglossal nerve. The hypoglossal nerve tends to cross the occipital artery from the posterior aspect. So I'm just going to draw that here, and it typically comes out this way on its way to the tongue. So it's a really good landmark. Sometimes it travels lateral to the occipital artery, which is actually more common. Sometimes it travels between the occipital artery and the external carotid artery. That's a lot less common. But from the retropharyngeal space view, please note that the hypoglossal nerve tends to travel lateral to the vessels in this carotid space, also known as the parapharyngeal space or parapharyngeal space. So this is cranial nerve 12. Okay, so back to our maxillary artery. So this is a magnification of that vessel. Here is the maxillary artery, and one of the things to note, let's just draw our path through the external carotid and into the maxillary, is we're going to go behind the mandible, or in other words, behind the medial aspect of the mandible. As we enter into this space, there are different parts of the maxillary artery. The first part here is typically vessels that are destined for skull structures. So, for instance, the inferior alveolar artery, drop of blood could go this way. The drop of blood could go towards the ear, so the anterior side of the ear, or through the anterior tympanic artery. Here is the inferior alveolar artery name. It could go to the deep ear, deep auricular artery. It really doesn't matter. The point is, it's going to skull structures. Having said that, probably the most important artery to pay attention to is the middle meningeal artery. And I'm actually going to draw that. We'll use a deeper color. The middle meningeal artery courses into the skull and goes into a little hole called foramen spinosum. Now, the reason why the middle meningeal artery is important is because on the other side of this structure, which is called the pterion, this is the part of the squamous part of the temporal bone and its articulation with the, so here's the temporal bone, here's the sphenoid bone, here is the frontal bone, and here's the parietal bone. It's at this juncture where the middle meningeal artery is doing all sorts of branches like this. And it happens to be the weakest part of the skull. So fractures here at the pterion have immediate consequence. So lateral blows to the head can immediately affect the middle meningeal artery. This artery travels between the skull and the periosteal or endosteal dura. There are different names for that dura. And so if the artery is severed, the bleed will happen between the dura and the bone, and we call that an epidural bleed, or epidural hemorrhage. And I'm sure you've had clinical lectures in radiology in looking at what those epidural hemorrhages are. They can be insidious, they can be very quick, they can be very slow, and the best way probably to diagnose them is through CT scanning. What you look for is patient history of blow to the side of the head and a change in affect in the patient. It's particularly concerning for kids who play sports that, like baseball or softball or hockey, or skiing, skiing accidents. Those kinds of things are very concerning. Always wear a helmet. Okay, and then going back to the maxillary artery. So the maxillary artery continues on, and then it encounters the vessels that supply the muscles of mastication. So I'll highlight that in another color. So here are the muscles of mastication. Okay. And so pick a muscle of mastication. You're going to have an artery that goes to it. So, including the masseter, the buccinator, going to the buccal artery. So this is a little bit of a misnomer. The buccal region of the cheek and the buccinator are in the same region. The buccinator is actually a muscle of facial expression, but in infancy, it acts as a muscle of mastication, as it's an important muscle for sucking out milk, like out of a bottle. The vessels to the temporalis, deep temporal arteries, the pterygoid arteries. Here's a pterygoid artery. Obviously the muscles are not in this image, but you can imagine that. And then the maxillary artery goes into its final section, which is typically drawn here. And these are the branches that go to the inner skull structures. So the teeth, the superior alveolar arteries, the anterior, the middle, and the posterior. The anterior artery can also receive branches from the other arteries, the anastomotic arteries deeper in the skull. But typically the posterior arteries and the middle arteries will come off of the maxillary. And then very importantly, this artery right here changes from maxillary to the sphenopalatine artery. And the sphenopalatine artery is the artery that is going to enter into the nasal cavity. So here's a magnification of this. So this is the sphenopalatine artery as it courses into the pterygopalatine fossa, and the fossa, as you might remember, is bounded by the pterygomaxillary fissure. Right there, that is the external door. Here is the pterygopalatine fossa, which lies within that fissure. And on the other side, which you can't see in this diagram, is a little hole called the sphenopalatine foramen, or SPF. And the sphenopalatine artery will travel into the SPF to enter the nasal cavity. All right, so let's take a look at the nasal cavity from the inside. Here is our maxillary artery coursing this way. And now we've entered into the pterygopalatine fossa, and this right here is the sphenopalatine foramen and the SPF. And the sphenopalatine foramen again went into the sphenopalatine the sphenopalatine artery went into the sphenopalatine foramen. And then from here, it does all sorts of branching. On the lateral wall, it will provide the branches to the lateral nasal wall. And notice that it will anastomose with ethmoidal vessels, which are branches off of the ophthalmic. And it will form this plexus here called Kieselbach's plexus. This is the plexus that is typically responsible for epistaxis or nose bleeding. The other thing too is there's an anastomosis with the greater palatine artery, which is in the palate, and there's a little anastomosis through the incisive foramen there as well. If we look at this from the medial wall, so this sphenopalatine artery here needed to march on the onto the nasal septum, so it crosses the nasal cavity and will provide branches. Notice that the words are backwards here. The reason why that is so that I could show the image opened up like a book. As you can see there it is, open like a book. And so these branches are going to the nasal septum, and these are primarily the nasopalatine branches. There you go. Now that word is left to right. So you have a plexus of vessels on both the medial and lateral walls of the nasal cavity. All right. So our blood has made our drop of blood has made it to the nasal cavity, and now we've got to figure out how to get back. So now we could have gone to the eyes, which we will do in another exercise, but here is the venous drainage. The venous drainage in the nasal cavity is going to follow that of the arterial drainage, so we'll draw this in blue. The veins aren't shown here on the image on the right, but you can imagine that these veins can make their way back into several routes. One route is to go from the nose and somehow drain back into this pterygoid plexus of veins right in here. It can drain out the side of the face, back down through the facial, or it can come down through the retromandibular vein, which is shown here. Or the venous drainage can make its way from the pterygoid plexus into the cavernous sinus, which is back here. Here's the cavernous sinus. It can go into this region. And once a drop of blood drains into the cavernous sinus, it can go through any of the dural venous sinuses, which you might remember is formed by the splitting of the endosteal dural layer and also the meningeal dural layer. Either way, the blood makes its way into the internal jugular vein somehow and will course down to the heart via the brachiocephalic veins. Alright, so that's the main drainage, brain supply and drainage to the head and neck and the nose. And we'll take a look at some other structures in other videos. Alright, thanks a lot.